to order the Board of Health meeting for June 18th, 2024, 6:30 PM, Harwich Town Hall, the John B. Griffin Room. As required by law, the town may audio or video record this meeting. Any person intending to audio or video record this open session is required to inform the chair. Anybody? Okay. All right, that was a call to order. So the first thing on our agenda, so we don't blow it like we did last year, is we have to restructure. So, what are you guys thinking?
Can we
I think we should keep it the same.
move this to the next meeting without
Gordon?
Pam being here?
No, we're supposed to be doing it this first meeting.
Okay.
That's when you're, it's not by law, but that's when they want you to do it. So, oh, I think that might have been her, so,
So it's the board's opportunity to restructure. You can keep it as it was with Sharon as the chair, Pam as the vice chair, and Ron as the clerk. You can switch things around a little bit if you feel like you want a new chair, if you want a new vice chair. Any of the positions can be moved around in any kind of configuration that you deem
absolutely.
Okay.
appropriate.
Is this open for discussion before we make any decisions?
Absolutely.
Okay. Well, just start with the bat. I know you've approached me before about wanting me to step up down the road and you wanting to come down from the chair, and I'm willing to. I was wondering if we're all gonna sit and vote on this tonight, would you be willing to stay on as chair for one more go around?
Sure,
If we were to put me in as vice chair?
Yes.
And let me
yes,
pick up some advice and
Yes.
learn from you a little bit?
yeah. All right,
Okay.
I think that's a good plan.
I would take a nomination under those conditions.
Okay.
Does anybody want to nominate those positions, or do you want to nominate for chair and let Sharon nominate for vice chair? Does anybody else have any input to whether there's an objection with that plan, or, I mean, it's
Open, yeah.
up to
Yeah.
all of it.
Fine.
Yeah,
I think it's a good plan.
Yeah, yeah, I do.
Kevin, as
I
you
have no complaints.
Oh,
you've got
okay.
many years to go, hopefully.
But,
Yeah,
before I jump in with both feet,
yeah,
let me stick
Yeah,
one foot in
yeah,
first.
you gotta get a
and
couple of
take-
years,
Yeah,
yeah, all right, that sounds like a good plan.
would appreciate that.
All right, that'll
Okay.
work, that'll work.
do we want to change up the position for clerk, or do we want to have Ron stay on as clerk?
Since you sometimes can't make it, is it just as easy to keep Ron as
Yeah.
clerk? Yeah, yeah, I'm happy with that.
I'll stay.
Okay,
Those duties, all right.
all right, so you want to make a motion and then say who's going to do what, or?
Can I make a
Yeah.
motion for all three positions and we
I
just
don't
vote
see
on
why
it?
not.
All right, go ahead.
I would like to make a motion as far as the restructure of board members, to keep Sharon as the chairperson. I would like to make a motion for myself to be vice chair and to keep Ron on as the
Clerk.
clerk.
Okay.
Those three positions, any?
Okay, I second.
All in favor?
Aye.
Aye.
Aye,
Aye.
all right. New
Done.
vice chair.
All right.
I'll have to skip a meeting or two and let you do it.
You have to, no, you have to come forth.
Oh, yeah, that's true, I do, yeah. Can we do that sometimes if I can just, even though I'm
Just
here?
not the first one.
No, I won't do the first one.
Yeah, I don't see why it.
Why you
it-
couldn't.
If you wanted to let
You could probably call in.
Kevin
Yeah,
to
yeah.
run the meeting for you and get some experience.
Yeah.
Great idea.
Yeah, that way, yeah, I know that feeling, you
I think
kind
it's
of
a
like
great
to
idea.
get into it easily.
Yeah.
All right. All right, so, Ron, all
Okay.
right, you can come up with the next thing on our public
On our
comment?
list, Okay. Public comment?
None. Or,
None?
no,
There's
we
none?
don't know. We don't know yet.
Nothing on-
We didn't have anything on
Nobody
there.
on the TV? Okay, all right.
Is the person on the TV for comment?
No, for the modification,
So he has
On
an
board side
application
only.
on the agenda.
Okay,
Okay,
all right,
all right.
so the minutes,
Minutes of the previous meeting?
go ahead and say which ones.
The April meeting, April 17th meeting? Any negatives or positives?
I have no
No.
corrections.
No, I didn't either.
Motion to,
I think,
Go ahead, Ron.
motion to approve
Oh,
the,
no, wait,
Yes.
excuse me, I did. On
The vote.
item B, test holes.
Yeah, the
with
test holes.
revisions is what you brought up to me.
yes, we didn't have the vote zone on that.
So we just gotta list the vote.
Yeah, we did have a vote
Approve
on
it.
that. Not that I remember, but I guess you can check that, right?
Yeah, I think there was a vote to
Probably.
modify,
And also
to
the votes
accept the
were
revise.
adjourn. It says 5-0, but there's only,
How many were there? Oh, there were only
vote to
four,
adjourn, approve 5-0.
and it was only
Should be
four.
4-0.
Okay.
So I think those revisions are simple enough that you could vote to
But
approve. with-
Approve them with those revisions,
Yep.
yes, all right.
motion to approve the April 17th meeting with the provisions for the test holes. Is that how we,
The revisions as stated.
the
Yeah,
revision
I
stated?
stated, all right.
I second that motion.
Vote?
Aye.
Aye.
Aye. All right,
Old business,
none? And new business.
new business. Approve Tier 3 beach sampling variant application to send to the state. Wilfer Road.
So this one, we got clarification that we no longer have the variance for this, and we just do weekly testing as required, so there's actually no action to be taken on this item.
All right. All right,
Next one. Reconsideration of previously approved variance conditions. 7 Sandy Lane. Request to finish attic area for additional living space.
so somebody here for that?
Yes.
You want to say?
Yes.
Oh,
Okay.
So we have the applicant and abutters. So
Pardon?
if you want to open it up to the applicant first and let him
oh,
speak.
he's, okay.
Yep.
All right, go ahead, we'll open it, go ahead. I'll let you do it.
Open to the applicant.
Okay. Yeah, so I just recently purchased this property back in March, and we want to renovate this property, and we found out that there is a variance which requires the attic to stay open. So I'm applying for the variance for the modification of the variance to make it an open space and add the bathroom there, without making any bedrooms or making any sleeping space. Basically, it will be, the entire attic will be an open space.
All right. Does anybody have, did you guys look at it? Do you have any comments? I have a question.
Sure.
Looking at the drawings that we have here in front of us, we have the main floor, which has 2 bedrooms. We have the basement with 1 bedroom, and then
That is correct.
and the existing attic is just showing the stairs and a chimney. And then, all right. And then we see the open space with the full bathroom. And I guess I have a question, why you would have an open space with a full bathroom? Because to me, that leaves open the possibility of a bedroom.
Well, I have 2 small kids that I want to create a play area for them. They 4 and 10, and and it's basically maybe I'll keep my desk as well there for small office.
How do you
there
access
is
the
no-
stairs on the main level up to that second story? Is there a door that you have to walk through and the stairs are enclosed, or is there any opening on the second floor?
No, it will be no doors, no door, and it will be open, and it's the wall will be cut off, so will be just a rail from.
So it would be an
from
open rail
downstairs
up the
to
stairs to the open space?
Yeah, that is correct. Yes.
And at the top of the stairs, how will that be laid out? Will there be a half wall or just a railing, or Like, how will you transition up
It
the
will-
stairs?
It will be a rail with vertical pieces of wood. Basically, there will be no half wall. We will put the rails.
So the property's currently in a map zone 2, restricted to 3 bedrooms. It's up to the board on whether they feel like this is a potential bedroom or not.
I do have concerns about that. I would feel better if that was a half a bathroom rather than a full bathroom. I think that just leaves it open to make it another bedroom.
Yeah, okay, yeah, we can do half bathroom.
So then do they have to come back with a,
So I think we might need more detailed plans with a clearer picture of how they're going to eliminate privacy. These plans are very basic, and it's hard to get the fine details as to what he's proposing from these plans.
yeah.
I think it's hard to see with how narrow everything is, that you can really eliminate privacy without opening things up wider. And I just don't know
But it
from a
will be,
structural standpoint how.
on the entire attic will be no wall separating.
Yeah, but the attic space
Space.
itself could be viewed as a bedroom. Based on this sketch, it's hard to see that it doesn't meet the definition of a bedroom, based on our bedroom regulations. And where you're in a map zone 2, the property is restricted to 3 bedrooms, and we need to make sure that this, if you want this space to be considered a bedroom, you could do that, but you'd have to eliminate one of the other rooms being considered a bedroom. So there's ways to work with the floor plan, but we can't have it where it's just, these plans aren't clear enough to eliminate our concerns with this being a potential bedroom. And we're happy to have you come in and talk to us in the health department and figure out ways that you could work the floor plans and come back next month as a continuation.
Okay, sure.
So if the board wants revised plans or modifications to the floor plans, you can choose to continue it
Continuance.
with clarification on the floor plans.
This one here.
Okay.
And if you wanted to allow
Oh, any
the
comments?
others
Any
to speak
comments?
before we.
I've got a few questions.
Sure.
So if you could just step up to the podium and
Or sit here if
introduce
you're
yourself.
more comfortable.
Yeah, if you're more comfortable sitting.
Especially me. How you doing, Boris?
Hi, Dan.
Good. I'm your next door neighbor, number 11. So I had a few questions.
You could just state
Your
your name,
company is an LLC company.
sir. If you could just state your name for us.
Oh, my name is Dennis Moranci, 11 Sandy Lane,
Thank you.
5 foot 10 and a half inches. Not much here. My questions are, you're an LLC company along with your partner, Zoya Sheshko-Reskova. And my concern is that you're taking this, buying this building, you live in Lexington, and you're purchasing this as a rental property that you're gonna just rent out through an agency somewhere. Are you gonna actually reside here, or family only? Or are you gonna be renting the property out?
No, this is not a rental property.
There'll be no rentals,
No rentals.
no rentals.
And just for the record, there is no health stipulation that would prevent him from renting. So understanding that it's a,
Well, no, then my next
Yours.
question was,
as an abutter, but it's
Right.
not a health.
it's, right, so my next question was, if it was gonna be a rental, what's the maximum number of people? And based on earlier conversations here, it sounds to me too like you wanna get a bedroom upstairs. And if it was a rental, how many people could be in there? But more importantly, I don't know the existing septic tank, is it a 1,500 gallon or smaller? And has that passed the Title V inspection yet?
So I think it recently had a passing Title V when he purchased the property.
Okay,
I think some of the
this is
concerns.
stuff I wouldn't know, so.
Yeah, for that, Might have been the bedroom count when we were reviewing that. Yeah, so we just noted that the property is restricted to 3 bedrooms and that minor repairs were necessary, so septic tank covers needed to be brought up to grade. Other
Okay.
than that, it's functioning.
So the tank is 1,500 gallons minimum, which is required.
It could be a 1,000-gallon tank based on the age that it was installed.
Right,
I can
so
double
to
check.
add another toilet there, now you may even be pushing the limit if in fact it is a 1,000-gallon tank.
Well, it's restricted by bedroom count.
Yeah.
It's 1,000-gallon. We have a policy that will let 1,000-gallon exist as long as it's not leaking or functioning.
Yep.
As part of the Title V inspection, they're supposed to check that, so it is functioning. In the event that the septic tank needs to be replaced, it will have to
And
be
you have to go up to
upgraded.
15?
Yep, in compliance.
So yeah, my biggest concern again was, again, if it's gonna be any rentals down there, because I don't wanna see new people every week coming in and out and dealing with the traffic, the cars, and all that.
Irrelevant here, sir, again.
Is it relevant?
Yeah,
Okay.
unfortunately, yeah.
And the other question I had, while you talked about putting a bathroom upstairs, was the attic gonna be open, an open stairway? Since you mentioned that, or is there gonna be a door closing off the attic?
That's what we need clarification on.
Because if it's open, I assume the attic is fully insulated? Or is it unfinished and just E-vents with the insulation in the floor?
Why we asked for
Right.
more definitive
Yeah.
plans, sir, because we
So
had
if
the
it's
exact same
open,
question.
everything's gotta be insulated and sealed tight to the weather.
It needs to be opened and not be considered a bedroom, and that's exactly why we asked them
And
that.
it can be finished, it can't afford privacy,
Okay.
so.
And I had one other question for you. There was a demising fence, a split rail fence between your property and mine. And when your clean-out crew came in and cleaned the yard, they took out the whole fence. Are you gonna put another fence up between myself and your house?
At some point, yes.
Well, at some point,
We
I
need to
mean,
level the lot.
right,
Yeah, we need to level the lot.
that fence belonged on my, belonged to me, to my property.
Yeah, and that's more of a civil matter if he removed your fence.
That's the only questions I have, which,
And we're going to continue this until next month, it sounds like, until we have more definitive plans.
okay.
And you can come in and
See the
review
plans?
those plans at any time,
Oh, okay, I wouldn't mind.
once we have them.
Yeah, okay. And if they leave it open, I gotta make sure the heating system's big enough.
If you want, you can email our department and ask to be notified when those plans come in.
Okay, thank you.
Yep.
The variances are also posted online as well.
We try to make it as accessible as possible. Yeah.
All right, anybody else, questions? All right, go ahead.
Option 1, continuation if the board will require additional information or wants to take matter under advisement, the following motion is recommended. Move to continue the hearing for 7 Sandy Lane to earlier than 6:30 PM on the next meeting, which is in July 16th, for the following reasons.
That we need clarification on the floor plans.
Clarification.
Second that.
You second it? Okay, vote.
Aye.
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 So this matter will be continued until the July 16th, 2024 meeting at 6:30, pending revised floor plans showing a little bit more detail of what you're proposing.
Okay,
Okay, thank you.
all right, thank you. Thank you.
Thank you.
All right, can I disconnect now?
Yes,
Yes,
thank you.
Okay, thank you. Okay, have a good night.
thank you.
Thanks for your time.
Thank you.
Thank you, sir.
You gotta kill the bass on your speaker system. No, it's tough to hear you, everything's muffled because of all the rugged stuff.
Yeah.
They're working on it.
Are they?
I think it's the second meeting in the new room, so.
They had trouble last night, we couldn't hear.
Yeah,
Always something new. Thanks again.
thank you.
So even with that, they couldn't, with having it closer, you couldn't hear.
And it's hard to pull the mics closer because some of them.
Well, this one
Yours
was
is good,
working.
But I was trying to move
Yeah,
those
that-
mics
that-
I
down
moved
there.
mine back because I know you guys told me you really don't need it most days anyway. I did before the meeting, so I,
Okay.
I usually line you up to position your microphones in a certain way. That's why I preset where you're going to sit.
first time I heard that, it's okay.
We're on B.
B, variance request from the Town of Harwich Regulations 1.2210, 23 Mill Road, to consider variance request from the Town of Harwich Regulations .210.
Hello, Dan Croto from Moran Engineering. I'm here with Deborah and Mark Ellis, the owners of the property. The existing house is a 1950s house. They originally were looking at remodeling that, but it impractical because of the foundation and the construction of it. So they would like to do this new house, and they provided the floor plans, the new floor plans. As part of this, we're gonna put in a new septic system with a treatment unit to knock the nitrogen down. The state testing requirements is for approximately 50% reduction in nitrogen. So the existing house itself, it's just looking before the meeting, well, the existing house on the septic plan's 4 bedrooms. Some reason the assessing department has it as a 5-bedroom, and the owners could tell what room would be considered a 5th bedroom, but anyways, the idea was to obviously keep the same amount of bedrooms in the new house. Floor plans were submitted, and greatly increased the treatment of the septic system, and the separation to the coastal bank. The coastal bank is in a situation like this, it's the limit of the floodplain. So it's not there really isn't an environmental impact on that. The marsh itself is much further away, but so the existing septic on the property has a variance to 70 feet from the wetland. We're basically matching that, we're at 71, and then with the IA treatment, leaching would be at 74. And then the septic system, the septic tank and the treatment unit are beyond the 50 feet, and they're monolithic tanks, so they meet the board's requirement on that. And I guess I will leave it with that, and we'll ask for questions. And we're here, and the contractor, the one that's hoping to do the work for the house, is actually the neighbor across the street, and he's in the audience also, so everybody but the architect here for you.
Yeah, and just briefly, we feel very lucky to have been able to purchase this house. First time it's been on the market since 1950, but it was built as a summer home, so the amount of cost to try and insulate the construction of the house is such, and we really wanted to put a garage on the property so that we could live there in the winter. So that was really the whole premise of this, was to be able to, and so Dan has worked with us to be able to fit the garage, fit the septic system, maintain the 4 bedrooms.
Looks very nice.
Yes, I'd say so.
Yeah, I didn't see any issues with it. Did you?
Now, there is an increase in habitable space from the original floor plan, but there's not an increase in bedroom count. They are reducing the setback requirement
Yeah.
for the SAS, so they're actually improving conditions. They're further improving the conditions by adding the IA system, so, which you would require,
Requested, and thank you for
knowing that it's
doing
the
it.
environmental setback.
Yep.
So they're being
Yeah, the only
proactive.
question that brought up was, just as you were reading, you mentioned 5 bedrooms. I was gonna say, as long as we know it's staying at 4,
4.
great.
Yeah. Yeah.
Yeah, we have 2 kids. Four is more. is good.
Oh, wow. All right. So I didn't have any questions. Anybody? Questions?
None.
I don't have any questions.
Okay.
So, option 2, move to approve the reconsideration of a previously approved variance conditions and a new variance request of Title V. Reduction setback between coastal bank and leaching 100 feet required, 71 feet available,
And the correction to that is actually 74, so they're,
or 74?
yeah, I don't know where I got the 71.
The 71 excuse me, 71 is what we wanted. That was to the full Title V.
Okay.
And
all
then
right, 'cause you
IA
had you mentioned the 74 when you were talking about the,
Yeah, the actual installed system will be the 74. The conventional Title V is a 71. It's drawn on the plan. It's just a lot of different lines on the plan. It's shown on the plan.
but the variance requested is for the 74, the 71,
71.
71.
Oh, so
Okay,
then
never
that was
mind.
right.
So 71 is correct. Okay, all right,
Just
here
to
we go.
confuse things a little bit.
Okay, let me read that again. Reduction setback between coastal bank and leaching, 100 feet required, 71 available. The variance of 29 feet as requested with the following conditions. The dwelling is restricted to a maximum of 4 bedrooms. No further increase of habitable space or square footage without further review by the Board of Health. No garbage disposal is allowed. Innovative alternative technology is required. A signed operation and maintenance agreement for the alternate system shall be submitted to the Health Department prior to the release of the disposal system construction permit. The O&M agreement for the alternative system shall include a requirement for testing. The testing shall be conducted in accordance with the Board of Health protocol. The conditions and approval shall be recorded at the Barnstable Registry of Deeds.
How many years must they do those, the testing?
For annual testing, it's 4 times a year for the first 2 years, and then they can reduce to twice a year.
It's not expensive.
All
Second
right.
motion?
All right.
That's a motion?
Motion
Motion.
seconded.
Seconded?
Thank you, second.
Vote.
Vote.
Aye.
Aye, aye.
Great,
All right,
thanks.
thank you.
Thank you very much. You too, thank
for
you.
what you do, and Kevin, congratulations on being here. It was very nice the way you guys did that. wasn't it?
Okay, so the next thing on our agenda
Report of
is-
the Health Director.
Yes.
Oh, we got a lot of exciting things going on
Okay.
for the month of June. Our public needs assessment, we have finalized our contract with Crescendo to perform the regional needs assessment for the Lower Cape towns, Harwich, Orleans, Chatham, and Brewster. They have begun conducting secondary data research. Our focus group was held on June 4th, and stakeholder interviews are now complete. A community-wide survey will be conducted, and then the information will be compiled into a comprehensive report. I did send that survey to administration to ask them to distribute it to all boards and committees, so check your email for that survey. We'll send it along too. We would love your input
I
as
think I got it.
Harwich residents, yep. It's important for our public health knowledge, so we can know where we're falling short in our community, and if possible, build programming to help fill those
That's what-
gaps.
Yeah.
One of our identified gaps through some stakeholders meetings for other community health outreach programs identified a need for food, that there's food insecurity that's being experienced all over the Cape. So some of the things that we've been working on locally in conjunction with the town of Eastham as our partner is a community fridge. So we have been working together to build fridge programs similar to the one in Hyannis and P-Town. We have received funding for a fridge and freezer, and we're calling it the People's Fridge. The funding was secured through 2 grants. Our PHE funds covered the fridge, and the United Way awarded us a grant to cover the freezer. The goal of the community fridge is to aid in food insecurity, reduce food waste. We aim to collect ready-to-eat foods, preferably healthy meals, from local food sources to reduce waste while providing a free meal to the community. Volunteers from Harwich will be trained by the Health Department on how to check the refrigerator for cleanliness and temperature control, to stock contents, and to monitor content freshness. They can also be called upon to pick up ingredients that are donated to the community fridge. We have partnered with the Harwich Chamber of Commerce to help manage any donations, as well as the Family Table Collaborative and Food for Kids to provide meals for the fridge. We have also applied for a $2,500 grant from Shaw's Supermarket to help fill the fridge. So we're still pending approval for the Shaw's Supermarket grant, but we have Food for Kids that will be stocking 10 prepackaged lunches starting July 1st. The fridge is located over at our community center. So if you walk in the courtyard over to the left by the senior center door, they'll be located outside. It will be open and available 24 hours a day, 7 days a week. So if there's a meal in there, it's free to take, no questions asked.
The community center isn't open.
No, the fridge is outside.
Outside the door.
So for those
Oh.
that are too proud to walk through the doors of the food pantries and identify themselves, this at least gives them a place to grab a meal after hours when the building's closed, if they're more comfortable.
Oh, so it's physically outside.
It's physically outside.
So what prevents,
We're hoping that our residents know the intent of the fridge, respect the intent of the fridge.
Is there a sign there that says that?
That we will be placing signs to be, we also want to do a survey for people to anonymously, give us information as to what their family size is, what their needs are, so we can collect some data that way as well. We hope people utilize that survey. There will be cameras in the courtyard too, so if there is any vandalism or people placing things in there that don't belong, we'll be able to identify. If there's people that are over-consuming the products in there or just, taking it all, we can then create some kind of plan to touch base with them and find out what's going on and how we can
didn't you say
help.
there'd be some sort of a permit or something, or?
It will be permitted, so it will be permitted and licensed by us, so you will see that on your agenda at some point to approve the license for us. We have our ServSafe certifications and all of our allergen awareness, and we're pretty qualified to manage a
So we
fridge.
could give donations to the Chamber of Commerce?
Chamber of Commerce, and we're hopefully setting up a account with the Family Table Collaborative, so she'll manage any fundings that receive. They'll be dedicated for the town of Harwich, and she'll use that fund to stock the fridge with meals from her kitchen. So she operates from a licensed kitchen as well. So we're hoping to build that up a little bit, and then the Harwich Chamber of Commerce, when Cindy's not out straight with summer planning. Not that Cindy ever slows down, but we have the meals with the Food for Kids right now, and that's a great source. And then we have hopefully the Shaw's grant, that will be a great offset to that
Do you know who your contact person is over there
at Shaw's.
at Shaw's?
I do not know the direct contact. We've been working with the Barnstable County, who's done a lot of our grant writing for us and done the outreach.
My dad did work for them for just about 50 years, so I'm sure he might know a person or two. If we need to pull a string, let me know. I don't know what kind of connections he's still got, but that would be something that he would definitely step forward and be willing to at least pursue.
Yeah,
if it's
no,
needed.
it sounded
Let me
like when
know.
we reached out to them that it was a program that they were willing to fully support. The local manager there has been a very great contact. She's very receptive. It's just going through the proper channels with the grant funding. It's nice that they have that avenue that we can apply for assistance in that form, because it keeps us on the straight and narrow, which is the way we want to be with that kind of.
Question, actually. I know we have Sue Giselle, the town nurse. Do we have any, I know the family pantry, at least from my experience with them, they have a program where if the family pantry has anybody come to them with a script, a prescription, we used to have pads for it specifically at Outer Cape Health that were running it was a short term with a couple of the providers. We're really testing it out. And if anybody walked in with a prescription pad, no questions asked, they were at least able to come in and sit down and walk through and feel the process, get the feel for how the family pantry works, be walked through it. and walk out with a bag of food, regardless whether they qualified ultimately for it or not. I don't know if we have the opportunity or availability, do we have a contact with anybody that might be willing to facilitate that, if indeed that program, as I believe, though we're not directly involved with it as much anymore as Outer Cape Health Services, I do believe that program is still available and they have the same policy.
Understanding is that the food pantry is a no questions asked operation. So I don't think that people are required to give any personal information, but I could be wrong from what I recall in recent conversations, though, with Christine, I think,
It's
yeah.
been a couple of years since I've had direct contact with them, and it may have changed.
And they may have gone from that time to, let's just get the food in the people's
Absolutely.
hands and not make it complicated, and it might prevent people who need the food from coming in because they don't want to give identifying information or.
Absolutely. If we do hear from people, however, coming in, and if they say that they're diabetic or they have special diet needs, I know the family pantry has specific meal plans geared towards those types of people, and the fridge may not, but just if we can maybe guide those people in that direction.
And the Cape is a different animal where we don't, most of our people don't meet the income limitations that the state sets, because our base pay is a little bit higher in some areas because we are a tourist community. But that doesn't mean that people can afford to live here.
Yeah.
So I think the pantry may have moved to no questions. So I think that people who are in need can still.
Good.
But I will get clarification on that for you
Like I said,
from the
especially for
pantry.
people with special dietary needs, just to be guided in that direction is always going to be helpful, coming from a nurse.
Yeah, absolutely.
Yes.
And our next project that we've been working on is our community garden. So we have built a garden, we're calling that the People's Garden, to go in tandem with the People's Fridge. This is to help support the People's Fridge, provide education to the community on how to effectively manage a home garden, and build community resiliency. So far, the garden has comprised of items that the town already owns. We have 8 raised plastic garden beds stocked with various fruits and vegetables. The garden is currently being managed by Health Department staff in conjunction with the Conservation Department and Cultural Center. We are working on establishing a volunteer group and have built relationships with the Harwich Elementary School and Barnstable County Master Gardeners to create educational programs through the garden, such as soil nutrients, when to plant, what to plant, how to prune, and how to harvest. We hope to move away from the plastic beds. We currently received a grant from Cape Cod 5 to fund one of our wooden beds, and we're looking to find funding for another $2,500 for an additional bed. At this time, when I wrote this, we hadn't received the award from Cape Cod 5, but we got that $2,500 grant, so we can purchase one of our raised wooden beds, and that'll be for next season. We've partnered with Barnstable County Extension for a MDR grant application, also pending approval to construct a greenhouse to extend our growing season and be able to start from seed, adding additional education opportunities to our residents. And the next phase of this program, we hope to find funding for is a hydroponic garden, which would be soilless towers that would be able to extend the growing season and have indoor growing opportunities. So we're working on a lot of stuff.
Really good. Really, really good things. All right.
Other,
Well, correspondence.
Town of Harwich, well, no,
We got permits next?
Permits.
permits, I think. Oh, peepers.
Oh, did we put that under other for the PFAS?
Yeah, peepers.
Under other. So, we just wanted to show you what our DPH intern Sona has been working on. She has put together this quick fact sheet for the PFAS. It kind of lists out a little bit of what Harwich does, how we test, where PFAS lives, how it can spread, and it's just a quick reference guide, but I've also provided you with the PFAS information that is posted on the water department's website, and we're gonna be putting all of these references on our website as well, so it's accessible in multiple locations.
Is this going to also be accessed on the website?
Yep, so we're gonna put SONMA's quick reference guide on there, so people who only like little spurts of information can have the important pieces, and then people
that
like
wants to-
Sharon who like to do a little bit more sleep reading can have.
Sorry about that.
2 o'clock in the morning.
And she's even provided me with more
I know,
resources.
it's more. But I did want to add, because the water department does PFAS testing. We already do that, so we're ahead of the game. And they just had one done in January, and we have the results. That is on the, I don't know if it's on the water or wastewater site, probably just water. But we are currently up to date with what the new regs are with the 6 that they wanted tested. We're doing well in all the sites tested. So there was a person that had come to one of the other surveys that we had that was interested in PFAS, but just to let the community know that it is being tested, and we're doing well. That's thanks to our water department, and we go from there.
That's it.
So,
So just for your review and acknowledgement that it's gonna be, the information's gonna be available on our website.
and then we are going to, was it September? We're going to put together what we're going to do here as far as requiring it possibly, when we would require it for wells versus the water, the town water.
Yeah, so Sharon has requested in September that we put on a work session, a revision or review at least of our private well regulations to see if we're satisfied, if they've become outdated, if we need to modify anything or add any testing requirements. So we're gonna give you the current regulations. I'll go through it and make some revisions as to what I feel I would like to see, and then for testing requirements, I'll lay out for you the cost of testing, where people can get things tested, and what is recommended to be tested.
And then once we get that all settled, we can put that on our website after we get everything done and approved. Because I think this is going to be a very up-and-coming issue, federally and state. In fact, I think it has to, the one has to go in, when the final is 2027, and then another part of it is 2029, when the final regulations come out, and you're going to have to be compliant then within so many months after that date.
Why is it pushed so far ahead?
Because when the state comes up with, when they do those kind of things, it's always, they have to put it out there so people can comment, and then it takes a while till it comes back. So the regulations are out there, the draft regulations are out there, but the final regulations, the one, I think they said 2027, and the other one is
29.
29, I thought.
State doesn't move quickly.
No, they don't.
Yeah,
There's a lot of opportunity for comment, private,
Yes.
you know.
I will
public
say, though,
comment.
Massachusetts, there's a number of states that are already in compliant in what is required so far, and Massachusetts is one of them. So I think we're in good shape, but it's nice to stay up with it and get ours up to date for
Yeah.
when properties change hands.
Yeah, I think a lot of our regulations need to be looked at,
updated.
yep, at least reviewed by the board.
Yep.
Happy to make suggestions as to
Yep.
what we think, and the board can.
That's on our worksheets. That's on our worksheets. Okay, and I think, I think that was the last thing on our
Permits,
permits.
okay.
Yes, permits. And I moved that around. All right.
What is, gathering filling station, what is that? Is that just a gasoline station that has
So the Chatham filling station, she does, I think grains, and you bring your containers and you can refill them from a larger, it's a way to reduce plastic waste.
Okay.
So her operation is bulk items that you can bring your
Your own
smaller
containers.
containers in and fill.
Where is that anyway?
I think is she a mobile unit that is setting up at one of the events?
They're just listed as an event.
What did I do? Here it is.
From Chatham.
So she's gonna be at one of our events in
Is that
town.
right?
Yeah.
Okay. Paper.
All right. Motion.
Can you approve of permits?
Second that motion?
Vote.
Aye.
Aye.
Aye. All right.
Okay.
And do we have a motion to adjourn?
Motion to adjourn.
Second?
Seconded.
Okay, you can second it. All right, aye.
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 Congratulations, Kevin.
Yes.
Thank you.